about what we had found on our examination, but what I want to tell you is it's more important to find out who has what than what has who. Everyone wants to know, what do you call this I've got, Doc? We have brachial neuritis. What causes that, Doc? Have you ever seen that before? Have you ever seen a case like mine before? Don't you hear all the same things? Right? But by the same token, because I've been doing something for 53 years and I occasionally lecture somewhere, somebody thinks that I have a lock on what's wrong with people, and they all come up and say, what do you do for tic douloureux? You know, they don't do a little dance when they say that, it's like a rhyme. And I say, you don't do anything for tic douloureux because it's different on every patient. You fix what you find wrong. The key to success in chiropractic is to fix what you find wrong rather than identify what the problem is. And sometimes that element is lost because we have bought the medical model. And the medical model only works about 20% of the time in terms of diagnosis. When you have a problem, you should try to identify who has the problem rather than what is the problem. A good example, I had a patient in recently who had seen every good chiropractor in the United States, every good osteopath in the United States, every good dentist in the United States. Her husband is a very well-known biochemist. She was a lecturer at UCLA on motivational inspiration. She's well acquainted. Her father was a Canadian physician who did major surgery under local anesthetic. He was a genius at his own job. Yet this was a very sick and ill person who suddenly developed a lot of chemical sensitivities, a lot of extraordinarily difficult migraine, and a number of other problems. And quite often she'd see someone in a case. She had seen Tony Urea, a very fine chiropractor in New York. She had seen 4 or 5 very fine people in California. She'd seen some fine people in Canada. She had had all her fillings removed because she had a very high mercury level. She had many, many approaches, but no one had ever analyzed the structure of her dura. One of the things I say is we, chiropractic as a profession, are divided by the dura. We as a profession can be united by the dura and its attachments, and as a result, if you stop and think, when I have a problem with a patient, I say to myself, I say to other doctors, get 0 defect at the dura. Make certain you have gotten 0 defect at the dura, and then leave the patient alone. This patient had her ileocecal valve fixed by the standard method, which is very useful, maybe 200 times. They kept coming back. She had all kinds of sensitivities, and she had a pH of 6.2 in her saliva, which meant she was grievously lacking in the natural alkaline minerals and natural fats and oils. She had enough symptoms as long as your arm. Her biochemist husband, who's very well known in the biochemical field, had a stack of biochemical 24, 36, 94 SMACs, sequential multiple analysis, computerized evidence, all of which was of no avail. She failed the plus pattern. She failed the walking gait configuration. She had an extraordinarily disturbed temporomandibular joint. When we fixed those 3, the pH of her mouth jumped within 30 seconds to 7.2. Her ileocecal valve disappeared and never came back. She gained about 6.5 pounds in about 3 days, and her symptoms simply disappeared.